Hello and welcome to my Unit 3 assignment, dressing application. I have Mr. Bagel with me. He had an abdominal surgical incision with the Jackson Pratt drain or the JP drain. The patient had undergone abdominal surgery like an appendectomy. They have a midline abdominal incision and also have a Jackson Pratt drain placed to remove excess fluid from the surgical site. The simulation, I will be using my bagels to help you understand what I'm doing. Obviously, before the patient gets any type of dressing, I'll be needing to clean the patient before placing my dressings. So before I place any dressings, I'll clean the incision site. I'll use a damp paper towel to represent my cleaning solution. I will gently wipe away any dried blood or drainage. Here's my damp paper towel. I just got a little water on it, and I'm going to just clean. Obviously, you would like to do this gently so that way we're not hurting the patient or doing any more harm to the site. After that, I'm going to use a second paper towel, which represents my antiseptic solution. It would be similar to like betadine or chlorhexidine. I would apply this at the center of the incision to create a clean surgical field before any dressings were applied. After that, my first layer for my dressing is going to be a non-adherent dressing. This napkin here is going to represent my non-adherent 4x4 dressing like Adaptic or Telfa. I have a really hard time saying that. I'm choosing this dressing because it's not going to stick to the incision. It's going to help prevent any sticking, any trauma when the dressing is removed. It protects the fresh surgical edges and keeps the wound from reopening. I'm going to just place this directly right on top of my incision right here. I know it's coming up, I apologize. My next layer is going to be absorbent gauze dressing. I'm going to be using a paper towel to represent this. Relatively, I feel like it should be like a stack of 4x4 gauze, but I feel like if I just maybe do it like this. I'm using, I feel like this would be the equivalent of using 4x4. 4x4 gauze, I'm using 2 gauze pads in this layer. This layer is used to absorb moderate drainage, provide cushioning, and maintain a clean environment over this incision. Here's my 2 folded paper towel squares over the first layer. I didn't have regular napkins. Next, I'm going to be doing the drain dressing. This pen here is going to represent the patient's JP drain tube for exiting the skin. I am now placing the dressing specifically for the drain site. The napkin that I prepared does have a small slit in it. It represents the drain sponge. I also think you can call it a split dressing. The split dressing will allow it to fit around the drain without applying pressure or bunching up. Drain dressings are important because they absorb the fluid that leaks around the tube and protect the skin from irritation caused by movement. So I'm just gonna go like this and kind of set it there. Beautiful, beautiful. My third layer is going to be my ABD pad, outer protective dressing. The way that I'm going to represent this is just this large at-home towel I have. This abdominal dressing is used as the outermost protective layer. I'm placing it over both of the incision and the drain site. They can absorb heavier drainage, provide firm protection from the wound. They hold all the inner layers in place and keep the area clean and dry. And my drain is going to be like this. My drain is out right here, so it still has room to drain. Next and the final part would be securing the dressing. Typically use like a medical adhesive tape, and you would want to secure the dressing to where it's not, you know, too tight. You just want to make sure that it's in place, so that way the patient's circulation is not affected. Obviously you would use, like I said, medical tape. For this demonstration, I'm going to be using regular tape, and I'm just going to do 2 on the outside. Let's do a bigger piece. Just like that. Just to summarize, everything that I did, my patient had an abdominal surgical incision with a JP drain. I cleaned the site with simulated cleaning solution and prep. I placed a non-adherent dressing first to protect the incision, followed by the absorbent 4x4 gauze for drainage control, and then I placed a split dressing around the drain to protect the skin and absorb drainage. Finally, I applied my ABD pad as my protective layer and secured everything with tape. I really enjoyed this assignment. It kind of put everything in perspective for me and gave me, you know, some good feedback on how I kind of saw it in my head while learning, and it kind of just put it in perspective here. But thank you.